The first and foremost, thank you, Joy, for recording this. We want to start out really by celebrating some incredible So Everybody Can Move wins that have happened over the past couple months. And of course, there's been wins along the entire way for all of our advocates in all of our states. And I think that's an important thing to recognize. But of course, there's some kind of monumental additions to So Everybody Can Move. So I want to first start by sharing the mic over to Cheryl Sachs in Maryland to give us an update there.
Hey, thanks, Nicole. So on May 16th, Maryland became the 6th state to sign So Everybody Can Move legislation into law. Our bills, so we were cross-filed in the Senate and House. Our bills passed out of each chamber with about an hour and a half before session ended at midnight back in April. It was a whirlwind, to say the least, but a bunch of us were able to attend the bill signing, which was really exciting. And the governor actually spoke to 2 of the young boys who were there, and spent probably 3 times longer with our group than typical groups for the bill signing, which was really wonderful. So just because the bill signed doesn't mean we're done. The big compromise we made this year, and for those of you who don't know, so our legislation started as orthotics and prosthetics for physical activity and orthotics fairness for orthoses. We amended out orthoses. Maryland is in like a $2-3 billion deficit. So getting anything approved was going to be challenging this year that had a fiscal note, but we got ours through for activity-specific prosthetics. We already have insurance fairness for prostheses, and it's for all commercial payers and state Medicaid, which is really great because Maryland does not have a law. There are some states that have a law in place where you don't have to pass, Medicaid doesn't have to pass it. And I'm blinking on what that term is called. But anyway, so we've been moving forward, even though prosthetics is basically done. There's a whole implementation part that's going to happen, which I know that y'all are talking about a little bit later on this call. But we are spending time educating folks about orthotics, especially. So we've had 2 visits at the office where I work of the lobbyists representing the commercial payers, as well as folks for the Maryland Department of Health, including the director of Medicaid for the state, all have come to the office. And the feedback has just been really wonderful. Just again, we all get what we do and why we do it. But for folks who don't know a lot about it, it's for them, one of the folks, we had one letter of opposition, and he came to the office and sent me a thank you after and said, thank you again. Sometimes in Annapolis, which is where our legislative process takes place, we can get lost on policy behind the piece of paper. And this really made it feel real. So thank you for what you do. So that's been great. Right now, we're in the process of trying to plan a thank you reception for our bill sponsors, which is proving to be really challenging for many reasons, but we'll just keep pushing forward. There are lots of rules and lots of different things that I'll talk with you about later, Kyle, but yeah, there are lots of rules again that you have to play by when it comes to politics and elected officials, and just there are certain claims you do or do not need to make. And if you're inviting some folks, you have to invite these other folks, and you have to disclose everything that you're providing food and beverage wise, right? So it's anyway, but we're really excited in Maryland. It's been really fun with folks coming through the office that we can kind of share the news with them. And we have been slowly starting to share the news with our larger coalition as well, just with regards to what to expect. So again, we're really excited. Just the support from the overall community has been really, really special. For those of you who haven't seen the Orioles, Baltimore Orioles, the baseball team, really were unbelievable, which we didn't know was going to happen. But 2 young boys throwing out the first pitch in honor of Lynn Loss Lynn Difference Awareness Month, as well as talking about the passing of the legislation. So look for partners where you don't know if you're going to find them necessarily. And I guess I'll stop there. I'm happy to answer any questions now or otherwise. I know there's a pretty tight agenda, but we're thrilled and happy to be number 6 and excited to, oh, one last thing that actually this is important. So when our orthotics legislation was taken out of the bill, the compromise is that there is language that is now a law that the state has to look at the cost of orthotics legislation. And we are working closely with the Department of Health, the Healthcare Cost Commission, as well as our sponsors to try to make sure that that data is actually going to be helpful, not only for us, but for others. So we got a group together. We're actually providing them the codes that they should be using to look at. So our hope is that with the data that they will have and they're supposed to get it back to the chairs by December 1st of this year, we are hoping that that data, looking at the fiscal cost of activity-specific orthoses for both the state and commercial payers, will not only help us out with legislation for next year, but it will be information and data that everyone else on this call can use to support their efforts moving forward. And we don't have to pay for it. It's kind of our lesson here in Maryland. So anyway.
Awesome. Cheryl, what an incredible update. And, just want to say thank you so much for your leadership in Maryland. I think I would love to have just a separate webinar for you to share, and Terry too, and the successes, but to share everything that you guys have learned through this process. And I think what's incredible too, Cheryl, is that, you've never done this before, and you have just, you're a natural, you've just, every step of the way, you've known what to do and how to do it. So it's just been so amazing to learn from you from afar and just see your leadership, and just thank you so much for all the hours and time that you've spent on this. I know that we've chatted on the phone many times, but there are moments where we're like, where is this going? What's going to happen? So I think it is so important that we take these moments to celebrate this huge win and all the work that went into it. And I am looking forward to at the Assembly in September in Charlotte, North Carolina, if anyone's going to be there, for all of us to raise a glass to Cheryl and to others and to our entire team. So if you can be there in person, that would be amazing for us all to be together. And the other thing I wanted to point out that you mentioned at the start, Cheryl, was that Maryland's in a $2 to $3 billion deficit, and you still were able to get this through. So I think that's a sign for any other state that might think that they can't do something like this, even if their state's in a deficit, that there is still the opportunity to do that. So,
And that did not include the bridge collapse that happened a week and a half before session ended. So Maryland had a lot of chaos this year. It may be like that every year. I'm not sure. Sounds like, I know Terry's going to talk about Minnesota. Minnesota had some chaos this year too, between your senator with the break-in.
I was going to say
anyway,
that.
but yeah, it's definitely a battle. You have to have a stomach for it. But it's worth it in the end to be able to look in the eyes of your patient and say, you can finally get this. And we go into effect January 1st, 2025.
Amazing. I love it. Well, and that's a great segue in terms of chaos. I know, Terry, you'll be able to kind of speak to that, but want to hand the mic over now to Terry to celebrate Minnesota.
Okay, can you hear me?
Yes.
Nicole, you're good? Okay, great. So congrats. Oh my gosh. The work that's been done, well, for all states, right? It's for all states. So I'll try to be quick. I know Nicole asked for about 5 minutes. Aaron is on the phone with me as well, so I'll give him the opportunity to speak, but I'll go over some of the specifics. So on May 24th, very shortly after Maryland, Minnesota became the 7th state, when our governor signed into law a bill that was actually a tax bill that our bill was migrated into. It was a very complicated process at the end, especially in Minnesota. Our 2 bills, one in the House, one in the Senate, migrated into an HHS omnibus, which is a supplemental budget bill. And then that was thrown into the tax bill, which was a dump bill, they coined, at the very last hour of session, last hour of session, when there was utter chaos on the floor. All professional, respectful decorum went out the window, and they were just yelling at each other. And the Republicans and the Democrats it was just a crazy, chaotic, incredibly awful scene to watch. But as Cheryl told me, that someone told her, you don't want to really know how the sausage is made, you just want the end result. And so the end result was our bill passed. So our bill covers orthotics and prosthetics. It covers all ages. It covers commercial and public plans. It covers insurance fairness, activity-specific devices, showering and bathing devices, There's a prohibition against discriminatory practice in the provision of O&P care. We have removed reasonable useful life. And towards the end, when we were negotiating with the Minnesota Council of Health Plans, they said this is such an enormous shift in Minnesota for what we had and what we're moving to, that they are going to be taking orthotics and prosthetics out of the DME category and moving it into medical coverage category, which for those of you on the phone who know what we've been doing for the last, I don't know, 15, 20 years, that's huge. So we're very, very excited about what the end result. It is effective 1/1/25. The health plans really wanted that to move to 1/1/26. In fact, we thought we were going to have to concede on that, and we did not at the last minute. We were able to the legislators essentially said, we're not taking any amendments. We're passing this forward with the date and with all the provisions as is. So even though we had negotiated with the Council of Health Plans for Minnesota and conceded on a few points, the legislators said, no, we're not even going to hear them. So before I go into any further, I want to give Aaron the opportunity to have a few words. So Aaron, I think I see you coming in. You want to share some thoughts?
Yeah, just congratulates everybody. It was an incredible run, as Terry mentioned, not without a ton of drama and maybe some weight loss and a lot of swearing, but we made it through. But I just want to encourage everybody on the call that just because the sessions are over, keep in touch, and not only at the state level, but a federal level. One of the big turning points that I recall was being out in DC at AOPA, and we stopped into Angie Craig's office just to say hello, because she's already signed on to the federal legislation that is going. And just talking with her about the state level legislation, and mentioned that we were kind of held up in one of the committees that Tina Leibling was committee chair on. And she said, oh God, I'll call Tina this afternoon and let her know that she needs to jump on board. And by the time, I think I flew out to Austin that night, by the time we landed, we had word that, at the federal level, communicating with the state level had kind of turn the tide a little bit for one of our key contacts, and that's huge. And the summertime, I think, is a great time to attend parades, invite, and that your legislators are attending and things like that, or speaking at, or little dinners or lunches, or invite them into your O&P practices, and just continue to educate while the session is shut down. So thanks.
Yeah, and on that note, I will add that Governor Tim Walz here in Minnesota was a representative in DC in the House for Minnesota. And about, I think it was probably 8 years ago, we met him on the floor. Aaron and Nicole and Rob and I, actually, we were at a VA subcommittee hearing, and he did a shout out to Wiggle Your Toes and the Minnesota people in the room. And he remembers us from then. And he is now our governor who just signed the bill. So those connections are just, they're imperative for this process. I want to give you all just a little bit more backing before I go on. Is that all right, Nicole? Another minute?
Yeah,
or so?
absolutely.
Okay, so Minnesota, just as far as process goes, we started this 14 years ago with our first prosthetic parity bill. And so this isn't a Cheryl one and done, less than a year, I'm going to knock it out. We've been working this for literally 14 years. So you've got great examples of, a short process and a really long process. So we worked with the same lobbyist. This is the fourth time we had approached our legislature with an orthotic and prosthetic bill. 2 of the 3 times prior, we were successful. So now we've got the 3 out of 4. We worked with Sam the whole time, Sam Walseth in Minnesota, Aaron through Wiggle Your Toes, and MSOP, which is the Minnesota Society of Orthotists, Prosthetists, and Pet Orthotists, worked together to make this happen. MSOP is the society that actually put forth the bill and paid the lobbyist. And then we had our entire community. We had about, I would say, close to 70% of the O&P facilities or manufacturers based in Minnesota be a part of the process and all donate funds, become actual corporate members of MSOP, so we could pull the funds together to pay the lobbyists. Minnesota was in a surplus this year. So unlike Cheryl and the deficit, we had money to spend here. This was not a spending year that they were working the budget. So it had to be a supplemental budget bill, which you have a lot less chance of getting anything done in the second year. But here we are. We also had the trifecta. So we had all Democrats control the House, the Senate, and the governor. So they were saying if any a year it's going to happen, it's going to be this one. We did the Minnesota OMP Day at the Capitol. We did our rally. We visited legislators. We had the governor's staff come visit Arise, our facility. We had legislators come visit our facility so we could educate and like Cheryl said, how that changed the minds of several people. Certainly got one of the Republican authors to sign on our bill after that. And I think that's, most of the big points, the bullets. Really incredible that we got it passed. We're still pinching ourselves. We're still checking the language in the bill. It's a 22,000 page bill with, and I don't know, I think we're probably less than 15 pages in that bill. So it really was a mess at the end, but the sausage is made and we're super excited to move on. We certainly are going to need some help from Kyle, and so everybody can move, everyone, Nicole and Aopa and everyone across the board with what's next, because that's going to be a challenge too, to find out what's actually going to happen 1/1/25. So thanks for the time.
Thank you, Terry, and thank you so much for, your work, Aaron's work, everyone in Minnesota. As you mentioned, this has been 14 years in the making, and I think because it's incredible to see Minnesota's bill is the most comprehensive in the country. You guys included everything, and so I hope that you guys feel really proud of the work that you've done over the past 14 years to have a bill that's this substantial. And I know that towards the end, it sounded like many legislators were saying, our community has waited way too long for this. We're not even going to listen to the insurers at this point because people have been in pain and they need access. So incredible work with what you guys have built with your coalition.
I want to add that Nicole testified in Minnesota. So for all of you, I think most of you know that, but for anyone who doesn't, and we were told by at least 3 different legislators that the testifiers for our bill, and it was Nicole, and we had 3 young boys, and we had Sarah, 3 other amputees, I think a total of 6, was some of the most compelling testimony they have ever heard, some in 15 years, some in 20 years on the floor. In support of a bill. So that was it was amazing. So thank you, Nicole, also for being a part of our process here.
Absolutely. Thank you guys for letting me be part of it. It was special to be back as a Minnesotan. Amazing. Well, thank you, Terry. We're going to keep celebrating this and just incredible now that we're up to 7 states as part of So Everybody Can Move in 2 years. It's amazing. All right, so for New Hampshire, I don't know if I saw Senator Sue Prentice on the call, so I'm going to hand it over to Taylor Haynes, who's going to give the update on behalf of Senator Prentice, Maggie Bomber, and AOP as well.
Yes, hello everyone. So this is not my direct knowledge, but I received this information through Senator Prentice. So 2 things of note. The Senate Bill 177, so New Hampshire Kids Can Move, is on its way to the governor's desk for signing. So we're hopeful that that will be finalized soon. And that is specific to 1 activity-specific prosthesis for up to 18 years old plus 365 days. So essentially up to 19 years old, which is incredible. And that's a result of 2 years of hard work by Senator Sue Prentice, who did have to negotiate to just children and prosthetics, but it's absolutely a win and a foot in the door moving forward. And as Nicole just noted, Maggie Bomber was serving as her state coach and did a phenomenal job. So New Hampshire, once signed, will become the 8th state for So Everybody Can Move, which is incredible. So we're very, very pleased about that. And additionally, in New Hampshire, on its way to the governor's desk is a raise in the state's Medicaid rates for orthotics and prosthetics, which puts New Hampshire up to 90% of the Medicare rate. So that's a great improvement and not directly related to So Everybody Can Move, but that's a great example of what our initiative is inspiring on a policy level beyond physical activity prosthetics and orthotics. So a lot of exciting things happening in New Hampshire.
Awesome. Thank you, Taylor. And would you mind introducing your role with NAOP and the Oregon team as well?
Yeah, absolutely. So my name's Taylor. I live in Portland, Oregon, but I'm here in Washington, D.C. for the summer with NAAOP as their 2024 Brees Fellow. So I'll be here through the end of July, learning about policy advocacy and all the things. So absorbing a lot, super happy to be here. But when I'm not living in DC for the summer, I'm over in Portland working with the Oregon So Everybody Can Move team. So yeah, happy to see you all. Happy to be here.
Awesome. Thank you, Taylor. And yes, shout out to Senator Prentice, who's worked so hard on this. I hope that we can also see her in person and bring everyone together to celebrate all of this great work. So we are close to 8 states, fingers crossed on New Hampshire. So amazing celebration to start off this call. Now I want to just quickly share, and hopefully I can do this on my laptop here. Yes, looks like I have screen sharing ability. I'm going to share just a quick video as kind of one of our why stories. Oh, it says it's unsupported format. Well, I will
Nicole,
share that there's going to be an email, or actually, Kyle, can you share it from
Yep.
your computer?
Yeah,
That'd be-
I moved it over to YouTube.
Okay, great.
Yep, I'll do it right now.
So while Kyle's getting that up and loaded, this is for New Jersey, and it's highlighting a 13-year-old advocate, Logan Marmino, along with Steve Slowinski, who's been our state lead there. And this was some great media coverage.
Is Logan Marmino. I'm 14 years old. I'm an 8th grader at Medford Memorial Middle School. I'm a baseball player, sled hockey player, and a runner, and I'm also an amputee. I was born with amniotic band syndrome. I don't know what it's like to have 2 legs, but I do know what it's like to be able to run as fast as my peers, beat my mom and grandfather in a 5K, and steal the bases on the diamond. It is my sports leg or my baseball leg that allows me to compete in able-bodied sports.
This bill simply to me is trying to level a playing field for so many young boys and girls who just seek the same sort of active lifestyle that so many of our children have and so many others have.
Why is it that the leg I wear for sports is considered a luxury? Should the disabled community not be allowed to live the same lifestyle? Should amputee children not be able to run with their peers?
We shouldn't expect these individuals and their families with limb loss to navigate the fundraising and grant avenue in order to get similar care that we expect for ourselves and for our own children.
I do not have the luxury to choose to be disabled, but I do have the ability to stand here today and tell you that running and playing sports and living a healthy lifestyle should be something that is available to every child and amputee.
Awesome. Thank you, Kyle. I think Logan's words, Steve's words, Senator Troy Singleton's words definitely impact all of us and resonate. It's incredible to see this level of media coverage and continued coverage in Maryland, Minnesota, other states as well. Just wanted to share that. I know Steve wasn't able to join us today to kind of give a New Jersey update, but in terms of what he shared with me that I wanted to relay was just kind of 2 words, one, persistence, and the other, pediatrics. I think that is kind of the 2 takeaways for any state. And I think for Steve, he shared how getting in touch with the right individuals, the chairs of these committees, has been the biggest hurdle for him, but persistence has paid off. And really what was the turning point was getting Logan in front of these key individuals. And that kind of ties into the pediatrics piece of this. And I know Terry and Cheryl, shared how widely different their states are, but I think what every state's success has in common is that our narrative and the way that we frame this issue is so powerful that individuals can't say no to that, and also the involvement of children. So no matter what state you're in, no matter what makeup it looks like, those 2 things are absolutely critical. And yeah, Cheryl, wanna
Yeah, I was just going to add, so just to belabor that point. So our primary bill sponsor for our Senate bill, who happened to be the chair of the committee, she wasn't when we asked her to be our sponsor, but it worked out that way. But I saw her after, and she said the 2 things that help get bills passed are kids and puppies. She explicitly said that. And she's been in elected office for over 26 years, from starting at the local and moving her way up through the state to now chairing the committee. So it's just something to keep in mind. It helps. And I think we just saw from that video how powerful that can be.
Absolutely. We haven't done the puppies yet, so maybe we should think about that. Just kidding. But yes, on the kids, I think what we've referred to it as our not so secret weapon, and to always remember kind of where this initiative started, so kids can move. And even though we've rebranded and been able to really push for access for all, it's really the children that are helping to lead the way on that. So that is great, and huge thanks to Steve for his work as the state lead. Maggie Baumer is also the state coach for New Jersey, and Steve had many kind words to share about Maggie's support, so I want to give her a shout out. And yeah, we've got our fingers crossed as New Jersey continues forward. All right, so now we're going to head over to kind of national updates. There's been some exciting kind of behind the scenes work by Kyle and Ange on the policy implementation side. This has been a really important thing, as many of our states have gotten legislation passed. We realized, hey, now we're not done yet. There's still work to be done and still support needed. So Kyle and Ange really took up the charge to help on the policy implementation side and create a pathway for these states that are getting in their legislation passed. So I'm gonna hand it over to Kyle and Ange.
Awesome. I'll kick things off, and then I'm going to ask Ange to kind of close this out about the O&P resources. So we designed the implementation guide really to support our state coalitions and O&P professionals with the necessary information and the resources for you all to implement your state's updated coverage for the prosthetic and orthotic devices for physical activity. And so in this guide, it's really going to walk you through not only the purpose and scope of the guide, the summary of the legislation, and also state-by-state coverage overviews. And then there will be very clear next steps for all of our state leads. And then lastly in the guide, it's going to be a pretty comprehensive section around the orthotic and professionals resources. Our hope is when you are reading this guide, it's a view as if someone has never has no understanding of the legislation, and really walking them back through the basis of this legislation and ultimately how to implement the bill effectively, from everything from how do you engage your Office of Superintendent of Insurance, how do you build relationships with the carriers in your state, but then also how do you spread the information throughout your community, especially members living with limb loss, limb difference, so they're aware of it, but also the O&P professionals, so they have some of the tools so that they can start taking the steps to providing this new coverage to their patients. And so in this guide, there are going to be lots of hyperlinked resources. One thing to note, there's going to be hyperlinked emails that you can send out to not only your coalition, but also the different clinics and manufacturers that are in your state. And then ultimately, for the O&P professionals, some just very clear next steps. And so I'd love for Ange to kind of highlight that. And if there's anything else you want to add, Ange.
Okay, thanks, Kyle. Yeah, Kyle and I, in putting this together, I mean, obviously the point of the implementation guide, it became clear that those of us that have passed these laws in our states, there's a lot of excitement and a ton of work going into it. But I think everyone's biggest fear is like, what happens on January 1st when this goes into effect? And people are like, so how does this work? And is it the government's job to make sure that this works? Or so I think ultimately that became the impetus for this guide, was just wanting not to rely on anyone else to implement this appropriately, and to have create a resource that we can use ourselves in the states that have passed, and that, you know, as future states come through this, can become a very plug and play situation for people. So we will be, and certainly we'll be welcoming feedback when it does go live. I think it'll be a bit of a living document, but yes, like Kyle said, there will be, I think we struggled initially to identify who our audience was, because there's so many different people that need this information, but ultimately we really focused on the O&P professionals. And then from there, they can give information to people with lived experiences, or to the insurance companies, or, you know, but the focus or the actual audience for this is for those of you in clinics. So it'll start out very basic and giving definitions of terms of like regulatory, you know, what does the regulatory process look like, or things that, you know, several of us have learned in the last year, and some are still, like this is all new jargon for most of us. So, and then it'll go into O&P resources as far as how to basically understand your law in your state and what the restrictions may or may not be, and then how to obtain appropriate documentation and what is needed for submitting a claim to the insurance, and then, for better for worse, anticipating maybe some denials, and how to fight that process. So we're hoping that the more organized we can be and the more uniform we can be nationwide, or at least within our states based on our own state laws, that there's less confusion. And, hopefully maybe the first 1 or 2 claims might be a little weird for insurance payers, but hopefully from that point on, they understand clearly what the new law means, and people have fewer hiccups in their state. So I think I don't know the timeline. Nicole, you can probably speak to that, but when this would be available.
Yeah, absolutely. We should have kind of the final draft of that. We're putting a bow on it right now, making it look all pretty. So we should have that within the next 2 weeks, and then we'll be able to have you guys get that out. And we'd love for you guys to share it again on another call. I know that this is kind of just the first of many conversations on this issue, and I think it's amazing. And also thank you guys for being so proactive on this and bringing this up as an issue, because I think, to your point, Ange, there's a lot of assumptions that sometimes, we'll hand it over to the government and, it'll just work out, but that's not often the case. And it's because of the complex systems that we're working within. So I think it is really important, and for us to continue to be advocates, even on the implementation side of this as well.
Absolutely. And I think the last thing I'll just say is thank you to a handful of you. I think specifically Kaylee, Autumn, and Nina, and Cheryl. Your feedback was much appreciated. And that's the same thing we want to open to you all. As you all see, especially for our teams that are going to be starting to implement the bill coming up in January, we want your feedback. And one of the key aspects of this resource is going to be a centralized folder that has some of those examples of documentation. And so we've had some of our amazing professionals in New Mexico that have offered their resources of example of medical necessity letters and, the scripts. And so I think that is going to be much needed as we build out this toolkit. So ideally, you don't have to reinvent the wheel. You can go there and see some examples to make your life a little bit easier.
And then I guess the final thing is, we had talked about having maybe some one-on-one meetings with states that are going live. And I wonder if it would be better just to have one meeting with all of the states, to go through this toolkit together for everybody going live in January, or maybe whenever they're going live.
I think that's a great idea, Ange. And when we get to the breakout rooms later today, if there's a number of individuals that are part of the kind of policy implementation room, that might be a good kind of first starter of the conversation, is being able to set up another call for that.
Cool.
Awesome. Love that. And in terms of these resources as well, I just want to share that, we're making these for the benefit of the entire initiative. And so we're consistently wanting to make them better. So as Kyle mentioned, your feedback and the more that we can compile information and what you guys are creating in the states is only going to make us as a movement together even more powerful. So thank you, Ange and Kyle, and for everyone's feedback and continued support as we continue to develop these resources.
Thank you all.
Awesome. All right. Next on our list, we've got Sam Miller, who's going to continue kind of the conversation on resources.
Yes, thank you, Nicole. Just in the interest of the agenda, I'll keep things pretty brief, but as you heard in, the Maryland and Minnesota process, that as states move through the legislative steps, things can get kind of hectic. And so I think it's important, now that many of the legislatures have died down a little bit, that we try to take a look back at the past 6 months and figure out what types of resources have been really effective. And I think what the national partners would like to ask you all is that if there are any types of documents or templates, photos as well, that you believe would be helpful on the national level that if you could please send those to advocacy@aopanet.org. We can kind of compile those now that it's the, the quote off season, unquote, and really make sure that we're upgrading the toolkits, both implementation and advocacy and lobbying, to make them as strong as possible. Just kind of thinking of a few, if you have a talking points document that really helped you, if there was some testimony that really you could use as a template that was really helpful, or pitching to media, things like that, we would really appreciate it. So thank you.
Awesome. Thank you, Sam. Yeah, Cheryl?
I think you guys already have like all our media stuff, but what I was going to mention, and I don't know if every state is the same, all of our written testimony. So in Maryland, it's a whole process, but you had to submit your written testimony prior to, and that is all published and it's public. So if you actually go onto the bills for Maryland, and anyone can do this, and Sam, y'all can compile this with AOPA. If you click on where it says witness list, it has an entire list of everyone, and it has like whether you were favorable with amendments, and then it actually has a PDF of what we each wrote or said. And for Maryland, we have like a few of us who are clinicians, we did individual letters. One of my colleagues who's a technician did a letter. We have from our pediatric patient, a few of the hospitals whose lobbyists sent stuff in, from physicians who sent stuff in, Peter Thomas, right? Like you can pull from that. And the other thing that we did that was a little unique, because we knew this process was going to be challenging, is we actually collected written testimonies from folks around the state, and we created testimony on behalf of those folks. So we had one letter that was from patients that had their written testimony as part of it, one that was from O&P professionals, and one that was from we kind of group all of Ally Health. So physical therapists, occupational therapists, social workers, physicians. So all of that is on the Maryland website. And I think that they all read a little bit different, obviously, and everyone's bills are different, but there's a really good variety and core that y'all can access from there.
Awesome. Thank you, Cheryl.
And our opposition's on there too. You can see what they wrote. So that way for folks who are, and what, Kyle, we knew about our opposition a few hours before our first bill hearing, right? So, but for those of you can see what those folks are really saying and writing. Oh, and you can see our absurd fiscal note letter from the Maryland Department of Health. So again, just gives you the whole picture. But that is all public.
Yeah, it's same with Minnesota, Nicole and Sam. It's all public record. There's even YouTube videos of the actual hearings and the testimony.
Excellent. I think what sounds like what could be a good solution to this is we've created a Google Drive so everybody can move, and to create a folder for every state that can be housed, and we'll have enough gigabytes to house all this information, but to organize it by state and kind of take it off of the legislative websites. So thank you guys for that information. We'll do some digging, but we also want to ask anyone to send us information our way, and including photos as well that we can compile. Awesome. All right. Trying to keep on schedule. I'm just going to do a quick update and on 3 items. One is that we're going to be doing another survey this summer to all of the state leads. We did this last year as well, just to kind of assess how state leads are feeling about their current role as a state lead, how things are going in the state, where they're expecting to be come 2025, what kind of resources they need, or any other feedback that we can kind of take in as an initiative and respond to. So just for any state leads on the call, just as a heads up, we're going to be sending out that survey to better understand where you're at and what you need. And then from a state coach's perspective, I know the summer is a very busy time for many people. So we're taking a little bit of a break over the summer. Of course, you're still you're still able to reach out to your state coach, but taking a little bit of a break so that we will then take in the feedback from the survey and then reassign state coaches come the fall, and hopefully be able to have some more state coaches come on board, because we are now up to 37 states that are actively part of this coalition at once. And that's amazing, but we also want to make sure we have the right resources to support all of you. And that's going to lead in nicely to what we're going to talk about in terms of 28 by 28 Mobility Challenge. Because this has grown so quickly, this has become something that we're going to need to fundraise and respond to from a financial standpoint, so that we can invest that money back into things like state coaches and resources and support all of you. And then the final update I wanted to share was just in terms of our website edits. I know many of you have reached out. We're working through those website edits as fast as we can. And if we haven't yet made one, please send it to us. We have a list that we're tracking, but we're getting to them as quickly as possible. And again, how that relates to the 28 by 28 Mobility Challenge, being able to fundraise for the national level so that we can do those edits as well. So Kyle, yes, please bring up the presentation and we'll jump right in. And as Kyle's bringing that up for the 28 by 28 Mobility Challenge, I'll just share a little bit of background. So many of you might have seen our Hood to Coast teams this past year and the year before. We really had these teams as a way to bring our community together and be able to fundraise on behalf of So Everybody Can Move. And what was incredible about that was, bringing people together to celebrate their mobility. But what we found is that there were so many people that wanted to participate and take part in the fun and the joy of movement. And so we thought about what could we do that could invite the entire community to celebrate together, and not just, a one-time relay in Oregon that we were doing. And so from there, the 28 by 28 Mobility Challenge was born. We pitched this as a concept to On and Right to Run. And they decided to help sponsor this incredible event so that we could bring this to all of you. And so I'm going to be able to hand it off to Kyle, but just real quick in terms of our goals, just so everyone kind of understands, why are we doing this? What are our goals? How can you all help? One of the top ones is that we want to be able to have 400 participants as part of this. We've already got 102 people registered, so we're well on our way. Over the month of June is our big kind of recruitment month, and then this is going to start in July. And then our goal is to raise $50,000, both through, individual giving, which is part of this event, but also through sponsorships. And as I mentioned, these funds are going to go back to the initiative to help fund kind of the critical work at the national level that's helping to uplift all of the states and support all of you through our state coaches, our guides, our toolkits, the website, and many other kind of resources to come. So just wanted to kind of share that, and think it's going to be a really fun month. So I'll let Kyle kind of share what it's all about and how it works.
Yeah, thanks, Nicole. And so this year we designed the 28 by 28 Mobility Challenge to be during Disability Pride Month, and really honoring and celebrating that month-long challenge. And so the concept around the So Everybody Can Move, the 28 by 28 Mobility Challenge, is to really encourage participants to dedicate 28 minutes of physical activity to your day, and for 28 days, and inviting your friends and your family and your community members to donate on your behalf. So think about this similar to some of you all have probably seen many different physical activity challenges where they're encouraging their friends and their family to donate on their behalf, similar to that peer-to-peer fundraising concept. And so physical activity comes in all forms. It can be running, it could be biking, it could be swimming, it can be jiu-jitsu in the park. And so we've actually created a really fun bucket list that will be available to all participants over the month of July. And the 28 days, each day you could do something fun and exciting. You'll see some some twists in there, yoga in the park, to going swimming with your friends, a dance party during lunchtime. But we're encouraging you to sign up on the Pledge It platform. That platform is actually integrated into a phenomenal tracking system called Strava that really builds the community. And so our goal is to see how far we can go. And so whether you're doing, biking or running or a form that does track miles, that will integrate. Otherwise, we're going to encourage you to do a conversion. So for every 10 minutes of physical activity equals 1 mile. And so our goal is to see how far we can go over the course of the month of July. And so how do you join? And so this deck that you're seeing that we're presenting through is actually available not only on the Pledge It site that is linked through our website, but also there is a robust landing page on the So Everybody Can Move website. But the first thing is to either join a team or create a team. We've heard a lot of feedback from different organizations throughout the O&P industry, but also many of you that this is a fun way to not only rally a group of friends, it's a way to engage your entire coalition over the month of July, but also it's a really phenomenal employee engagement tool, especially if you're a member of an O&P clinic or a manufacturer. It's a great way to build a sense of competition and camaraderie over the month of July. And so you'll be able to register there. And then that platform, which we'll go to in a second, gives you the A to Z of how do you participate. And so next is really the fundraising. Our goal is to make fundraising as easy as possible. One of the really cool things that we've heard from so many people throughout this process, especially Hood to Coast last year and getting ready for the 28 by 28 mobility challenges, so many people want to help, but they just don't know how. And one of the ways that they can help is by making a really easy donation. And 100% of the donations are tax deductible. And so they'll have the opportunity to make that donation. But really, our goal is to provide all of our participants the tools and resources to fundraise. The number one way to fundraise is to really tell your story and really inspiring your community around why should we have legislative change and how does legislative change really create access equitably to our limb loss and limb difference community, and how, over the month of July, many of us will be experiencing physical activity. That should be a right and not a privilege, and really being able to use this month to inspire your community and tell the story behind So Everybody Can Move. And so the Pledge It platform makes it really easy for you to upload your movement activities and integrate it into tracking devices. But also it's a great way for you to invite your community to donate personally to your page. And so the goal, the goal is to raise at least 280. And our hope through that is to incentivize you and give you just some really awesome ways to fundraise. So real quick is also, we're going to be encouraging throughout this month, anyone that does sign up ultimately becomes an advocate on behalf of So Everybody Can Move. And so our goal also through this is to really convert many of our participants to join your teams as the advocates on the ground and really become your champions in helping support you all through your legislative change. So this is also a great tool if you have friends that are on the fence. I don't know if I want to get involved yet or how to get involved. This is a great first step to invite many of whether they're clinicians or community members or allies, or also adaptive athletes in your state that want to get involved in So Everybody Can Move as an advocate. This is a great first step. We're lucky. We've had some phenomenal partners already jump in to want to say just thank you for fundraising. And so over the course of the month, we will be having secret challenges that will pop up throughout the challenge that you'll get messages about. But we have partners from Cotopaxi and On and Scratch. We just added a few more today that have confirmed. But then, so you'll have the opportunity to unlock these prizes if you are a top fundraising participant, either on a specific day or a week. Which is exciting because we're also going to be doing these exclusive So Everybody Can Move magnets. These magnets are representative of 4 of our amazing individuals with lived experience who are advocates who have testified on behalf of their state. So Hope, Nathan, Anya, and Louie. So you can be winning one of these exclusive magnets as well throughout the month of July. But Nicole, do we want to jump into showing the Pledge It site?
Yeah, and I'll just say for those magnets, those are some of our kind of star kiddos that I think will be really fun, and we'll be sharing a little bit more about each of their stories so that you guys can, know who's behind the magnet as well. Yeah, so I dropped in the chat kind of the 2 links. I'm seeing a lot of names on here of individuals who've already signed up, but if you haven't yet, one thing we wanted to get across is that our goal was to have a team for every state. And so if you're a state lead, you can be kind of the team captain for your state, or if there's someone else on your team that you want to kind of delegate this to, we would love for you to do that, and have kind of some friendly competition among the states as well. So maybe you didn't get a bill passed this year, but maybe you can win the 28 by 28 mobility challenge. So this is, if there's someone on here that hasn't yet signed up, I would love to use you as an example as I kind of share my screen and go through an example. Let's see if I can make this grid view. But yeah, if you want to raise your hand, or otherwise I can just re-register myself.
You can register me.
Yeah,
Okay,
there you go.
awesome. Melissa, what would be a good email?
majugo@med.umich.edu.
All right. So you'll easily kind of go on there to join. Let's see. Oops. And I don't necessarily want to create a password for you, so I'll create one, but then you can change it, and it'll be
That's fine.
everybody 28 by 28. Remember, maybe write that down.
Yeah, I'm gonna write that down.
Okay, great. And then would you like to join or create a team, or just join as an individual?
I'm gonna try to create a team.
All right. Let's
I
do
have
it.
some physicians who are chomping at the bit on this.
So then you'll create a team. What would you like your team name to be?
Ooh, so our limb loss community through AAPM&R, we had a meeting during our member May, and our community met virtually, and we were, so we're through AAPM&R, so I don't know, like, it's all physiatrists
Okay.
who are very interested in, well, somebody brought it up. They're like, oh, we should do the thing as a group. And I was like, we have like 580 members in our community.
Ooh, that would be
I don't know if
awesome.
we get all 580 doing the challenge, but
No.
I think we could get a good number. And I have to figure out, like, our community chair, I have to talk to him and figure out how we can organize, but I don't know what we want to call it. It's
Yeah, so this would be on behalf of kind of
of like, I
AAPM&R.
don't think we'll brand it AAPM&R because I'm not like
Okay.
officially representing AAPM&R. So maybe we should say, like, the official title of the group is Amputee Limb Loss Restoration and Rehab, but it's like too long of a name. It's a bunch of docs. I don't know.
Okay.
Melissa, what do you think about Friends of AAPM&R?
Friends of AAPM&R. I don't know if we should put AAPM&R even in the name. I'm just, because I haven't asked for permission or anything to say we're like officially part of the group, but it is a community of physiatrists that are all in here who have dedicated portions of their practice for limb loss, limb deficiency care all across the country. It's a national group of physicians.
How about limb loss docs?
Limb loss docs.
All right. And you can change this in the future, Melissa, too.
All right, that's good. I think everyone will recognize it.
I like it. Limb loss docs. All right, we're gonna create that team. And then I'm just gonna do kind of what we have as kind of the default for fundraising goals, but you can kind of go back in here and set it up.
Okay.
And let's see. You can choose like your miles goal. We'll just kind of put in 100 miles, but you can again kind of go back in there and set that up. What would be your shirt size for a campaign shirt?
Medium.
Okay. And then we'll have to include an address here. I can kind of just put in a standard address right now, and we can update that later, so you don't have to share your address with everyone on the spot, if that's okay with you.
No worries. I'll go back in.
Yeah, and then we'll submit registration and you're good to go. And then you would be able to connect with Strava as well if you have Strava. So if you wear a Garmin or any type of kind of wearable device and you already have that synced to Strava, Strava will then connect directly with Pledge It. So anytime you do an activity throughout the month, it'll just automatically upload. Otherwise, you can go straight into Pledge It and just manually upload your activities throughout the month. But we'll skip this step. You can do that on the back end. And so now you're ready to go. And you can kind of edit your team's story, make it about, the limb loss docs, the physiatrists, what you're doing. You can invite members on your team. We'll skip that for now. And then, of course, share it with the community as well. So,
Nice.
yeah, so you are ready to go. That's just an
fun.
example. So thank you for being willing to be our test subject on that one as we
I'll try to recruit as many of the 580 as possible.
Let's do
Love
it.
it.
Absolutely. That's amazing. That is a great group for this. Incredible.
And that's that's a great segue is so in the slide deck, there's also great opportunities if you are a part of a clinic or a manufacturer or community organization that is interested in sponsoring. This is a great opportunity for your company to use this as a marketing opportunity to get in front of amazing advocates all across the United States. And so we've created some really great levels. We've already had some phenomenal companies already jump in. One of the key things that we've seen as a benefit of being a sponsor is utilizing this also as employee engagement. A lot of organizations that have been super interested in participating in this sees this as a great way to unite, especially for health and wellness benefit, especially in the month of July, to get their employees active, but also a sense of camaraderie and community. But we've also created team captain resources, whether you are a team captain or you're not, and you're a participant, really is a great resource on how do you recruit your friends, your family, and engaging your community to register alongside you, but also some really good resources around how and why to fundraise. And so our goal is to make this as easy as possible for you to make a really big difference during Disability Pride Month. And so I want to offer to be of any sort of support. Will be available, this month and next month if you have questions, if you want us to be able to, especially like Melissa, you have, a large organization, if we can help you with any templates and resources to communicate out to them, we have those available as well.
Awesome. I just wanted to pull up our sponsorship page that's on the slide deck. As Kyle mentioned, there's kind of 3 different levels here for Power Partners at the $5,000 level, Mobility Partners at $2,500, and our Match Partners at $1,000. And I want to give a shout out to George Brees and NAOP for coming on board as our first Match Partner, donating $1,000 to the initiative and sponsoring this. So thank you so much, George, for that, and to our other sponsors that we have coming on shortly. So please reach out if this is something of interest for your group to be part of. All right. I know that we've got about 15 minutes left in our agenda. So what we're going to do is break out into breakout rooms. We wanted to do something a little bit different, have a little bit more intimate conversations with anyone who's on the call. And the way that we're structuring the breakout rooms is that we're going to have 3 different rooms, one for each kind of stage that you're at in the process in terms of your legislation. So room 1 is going to be legislation not yet introduced, and that's being led by Kyle Stepp, Whitney Doyle, and Olivia Keller, who are our state coaches. And then room 2 is going to be legislation introduced. That'll be led by me. Maggie Bomber's not here today, so I'll also be joined by Ryan. And then room 3 is going to be policy implementation led by Angela and Sam. So I believe Joy's going to get those rooms set up, and then you can kind of self-select which room you want to go into. And let's give ourselves maybe about 10 to 13 minutes to be in those rooms, and then we'll come back as a group and kind of finalize the meeting right before 2:15. All right, so hopefully you've seen a pop-up, and then you can just join whichever room you want to go into.
Nicole, where do I see the pop-up? Oh, here we go. I might have gotten it.
Right, and we're back. Looks like we might have lost a few people in the process, but thank you guys for a great call today. I hope the breakout rooms were a good way to have a little bit more of an intimate conversation with individuals. And yeah, Cheryl, would love for you to share before we end the call.
Yeah, I just before, for those of us who are in room 3, or even like those of you who are state coaches for folks who have passed legislation, if we could just hold on for 30 seconds, I think it would be really beneficial, as I think you alluded to, for us to set up another call to really kind of talk through some of the implementation stuff, whether we go through the guide together, whether you send out the guide and we talk about it afterwards, because I think we already all kind of have a lot of questions as to like, there's so many different folks that we need to communicate with, the docs, the payers, the O&P companies, the patients, right? And I think like I've never done this before, so I want to get this right for this community. So if we can set up a time and just, again, hang on the call for another minute, maybe look at calendars, that would be great.
Absolutely happy to allow that platform here for you guys to coordinate. For everyone else, I just want you all to know that our next call is going to be on Friday, August 2nd at 1 p.m. But of course, until then, please continue to stay in touch, and we're looking forward to having the July Mobility Challenge. So please sign up, super easy. I think the hardest part is figuring out what your team name is going to be. But other than that, we're really excited for this big month. So thank you all so much. And we'll stay on for those who want to coordinate for the policy implementation side.
Thanks, Nicole.
Thanks, everyone. Good to see you. Joy, you can stop.